This bill is also coming for the Affordable Care Act.
So the Affordable Care Act was a major overhaul to the American healthcare system that passed in 2010.
In addition to expanding eligibility for Medicaid, the Affordable Care Act also created a marketplace where people could buy health insurance at lower premiums and with subsidies. And since 2010, nearly 50 million people have gotten healthcare coverage through this marketplace.
While in the past there have been a lot of efforts to repeal and replace the Affordable Care Act, the Affordable Care Act is actually really popular. It's been one of the most popular and most successful bills that have passed. I know it's more than a decade. Oh my God, it's 15 years ago.
Yeah.
In the past 15 years. And currently, over 60% of Americans view the Affordable Care Act really favorably on both sides of the aisle.
And if you ask people, do you like Obamacare? Some people are going to say no, just because they're not going to like anything that's called Obama anything. But when you actually ask people about components of the Affordable Care Act, things like the Medicaid expansion, things like this marketplace, people like these individual components and have a favorable view of it. It has been good for the health of this country, especially for the health of children in this country. And we're at a place where the uninsurance rate is at the lowest that it's been, largely because of the Affordable Care Act.
But this big, very beautiful bill is going to change a lot of what the ACA has put in place. It has plans to shorten the enrollment period where you can enroll for new insurance through the marketplace. They're going to restrict special enrollment windows. If you lose your job, if you change jobs, even if it's not an open enrollment, right now you can enroll for a new insurance in these time periods of big life changes. That will become more difficult to do.
And it's also going to end automatic enrollment. And now, if you hear these together, shorten the enrollment period, restrict special enrollment, and automatic enrollment, none of this, again, is about verifying eligibility or appropriateness. This is all about making it harder for people to access the healthcare that the law and the government is providing. It's just about making it harder to get there.
And that people like and want. Over 50 million people have used this to gain coverage. And surveys have showed this is what people like and want.
But we're going to make it harder for them to access it because that's the way we can save money. I mean, in the short term. But eventually, people have to pay for things. So that'll be another issue. But this will make the numbers of the bill look good.
On top of that, there are plans to let some of the tax credits expire.
And these are tax credits which were expanded under the American Rescue Plan and the Inflation Reduction Act to make it easier for people to purchase healthcare in the marketplace. And this is a big deal because those tax credits helped people afford coverage. Without them, it's expected that millions of people will be priced out of being able to afford healthcare and that we are going to see the uninsurance rate in this country rise.
One of the most amazing parts of the Affordable Care Act is that it removed pre-existing conditions. It meant that people that had cancer, people that had autoimmune diseases, people that have medical problems, which is a lot of adults, they couldn't be charged a higher rate by their insurance company than someone who doesn't have that problem.
And while this bill doesn't explicitly bring this pre-existing coverage back, it is repealing protections that are helping people with pre-existing health conditions get coverage and have essential benefits.